Have you been experiencing knee pain? If so, you are not the only one. Welcome back, guys. It is Dr. Tom. Today we are looking at generalized knee pain. So this isn't knee pain that is caused by a more sinister issue like a ligament or meniscus, which if it is, you can click the top corner here for videos that are covering this area. But this is more for generalized knee pain. And when we look at this, we can break it down a lot of the time into knee posture. A lot of the time in clinic, when patients come in, you'll see what we call an increase in knee valgus. So the knees actually, I don't want to break my model here, but the knees will go more knock-kneed on the inside. Now, a lot of the time this can be due to weakness in the knees, but a lot of the time it can actually stem from the hips and the ankles. So the knee is a very simple joint. It's a hinge joint that operates between two more complex joints, which are the hip and the ankle. And when we don't have enough mobility in the hip or the ankle, or we don't have enough stability in the hip or ankle, which is that balance and the strength around those joints, the poor knee is left to do a lot more work than what it's designed to do. And then over time we can get degeneration, which is wearing down of that cartilage, and it can create aching. For a lot of athletes that I deal with who have that generalized knee pain, it can be due to things not operating in a perfect posture. So things being a little off center, you're relying too much on certain muscles getting too tight through the knee because there's weaknesses up and below it. So when we look at doing a program, we look at trying to create balance and get back to where we should be. Today we are going to show you through the 5 best exercises to get rid of your knee pain, to allow you to get back into things such as running and any other activities that you enjoy without that pain creeping in. So follow along, add this into your daily routine. If you've got a friend with knee pain, be sure to send it to them. It may help them out. And let's get into it, guys. Enjoy. Okay, guys, so to get going, we're just going to be sitting on the floor or on a table, whatever you've got around you. We're gonna roll up a towel, place this down behind the knee. And the main thing here is we wanna keep the heel in contact with the table to start off with here. So it's easier if we just lean back a little bit and then trying to squeeze the back of the knee down as hard as we can without lifting this heel off the table. So you gotta keep this heel in contact, squeeze down. When you look down at your knee, what you should see is the VMO muscle, the muscle on the inside of the knee firing. And this is a muscle that we call the stability muscle of the knee. So it stops that knee going into that knock-knee motion, which is what we want to eliminate for a lot of that generalized knee pain. So we're holding for 10 seconds down and then releasing for 3 seconds. Holding back down for 10 seconds, give it a very solid squeeze, try and get that knee as close to extension as possible. And then after that 10 seconds, a little release. And we're gonna go through 8 repetitions of this. Okay, now we've done our 8 repetitions there. What we're going to do is exactly the same thing to start off with. So we're gonna squeeze the knee down into the cushion, bring the ankle into 90 degrees, and then once this VMO is switched on, we can lean back, and this might make it a little easier for you. If you're forward, it makes it a little harder. We're going to try and lift the leg as straight as possible. Hold 5 seconds, 2, 1, slowly going down, relax. So starting off again, we're just doing 5 repetitions of this, squeezing the back of the knee down into the towel, keeping that heel in contact with the table. Once we've got that little muscle on the inside of the knee firing, we're lifting that leg nice and straight, and hamstring flexibility may come in for a lot of you out there. And after the 5 seconds, we're going to slowly drop back down, have a little rest. That is number 2, guys. Let's get into number 3. Okay, guys, so we're gonna use a foam roller here. If you don't have a foam roller, you can use cushions, roll the cushions up, and place it under the knee. Just something a little more than a towel to prop the knee up a little higher. All we're doing here, once again, using the arms behind for a little bit of support, and we're going into knee extensions now. So unlike the first one we did, that's more VMO, this is more a generalized quad contraction. So we're getting both sides to symmetrically fire as we lift that leg. So firing that leg up, holding for 5 seconds up, trying to kick the leg as straight as possible. And then from here, slowly control the down phase. So 10 repetitions here, 5-second hold up, really try and fire these quads, and then slowly down from there. Now, the progression with this one, once you get better, we can actually add an ankle weight on. So we can slowly start to add some resistance onto this. Once you've done your 10 repetitions of this, we're gonna move into the next one. Okay guys, so for the next one, we are going to go into what we call a modified bridge. Now with this one, if you're a runner and you've got back into running, things feel tight and you're starting to get that knee pain, and maybe that your posterior chain, which your glutes and hamstrings are part of that posterior chain, aren't firing enough. And it's one of the most common things I see with an anterior pelvic tilt. People come in, they're tilted forward, they're quad dominant, their back doesn't fire as much. So this one here is designed to try and get that pelvis to tilt back and start to get things firing as they should. So when you stride and run and your heel strikes forward, we're loading that posterior chain, not just the front, where the muscles will tighten through the knees gonna feel a lot more tight, that pain can come on and that whole cycle starts. Hands on the hips. From here, this is a modified version. So we're lifting up literally just an inch off the table. With our hands on the hips here, we're gonna drive the heels into the table, tuck the tailbone under, and you might even feel a bit of a stretch in the quads here. Try and fire these glutes, really trying to tuck them in and under that way. And after 5 seconds, slowly releasing, dropping down. So coming back up an inch off the table and then tuck them under. All the weight driving into the heels, holding for 5 seconds, and then slowly release. So we're doing 8 repetitions here. So an inch off, tuck those glutes under, and then slowly releasing. Now, if you're doing this and this is completely easy, you're cruising through it, we're gonna go single leg. So make sure you do this on both sides. The 8 repetitions, 5-second hold, so keep it the same. We're just gonna kick one leg out straight, start by lifting the glute just an inch off the table, tuck that pelvis under, so the same thing. Really drive down that heel into the table, make sure the glute's firing, and then slowly release after 5 seconds. So same thing again, hips an inch off the table, drive the heel in, tuck the pelvis under, hold there, and slowly release after 5 seconds. So 8 repetitions, make sure you do both sides. It is what we call glute med lifts. And when we talk about the glute med, this is a little muscle in the side of the bum. This is often weak in a lot of people, and when it is weak, the hips will move side to side, either when you're walking or running, and guess what that does? It creates an unstable platform for the knees. So if the hips are moving all over the place, guess what the knees are doing as well? They're moving all over the place. So we want strong hips to make sure the knees stay aligned and our posture is perfect. So all we are doing here, elbow right under the shoulder, keeping the knees nice and bent, hands on the hip, lifting the bottom hip up to start off with, and then lifting the top leg up from here. So holding here for 5 seconds, and then slowly down with both. And coming back up, making sure when you come up, those hips stay squared to the way the wall we're facing. And after 5 seconds, slowly down. And 7 repetitions with this, make sure you do on both sides. So once again, up, and slowly down. Now, if you're doing this and you've got either shoulder pain or it feels too hard through the hips, heels towards the ceiling, lifting up, and you're gonna feel this in the side of the bum. So after 5 seconds, slowly dropping, heels out, lifting up. You're gonna feel this muscle in the side of the bum. The higher you get, the better. If you're really weak, sometimes this will start to cramp, and slowly down after that 5 seconds. Okay guys, so last one, we're gonna go and jump on the mats. Okay guys, so for the last one, as we talked about, we want the chain, the hips, the ankles to be strong, to be mobile. So for the last one, we're gonna do just a little bit of strength work through the ankles. So we're gonna have the knee slightly flexed, not all the way down. And what we're gonna be doing here is we call these toe taps and we're doing them in a square. So you're gonna bring the opposite toes in forward, in front to the inside, in front to the outside, behind to the outside, behind to the inside. Now, while we're doing this, we wanna keep perfect posture and congruity through the ankle. So you'll notice that when your knee goes into valgus, that inside knock knee, your ankles almost go a little bit more flat-footed, pes planus, what we call it. So we want to try and maintain that perfect ankle arch. If you look down, make sure the ankle's up, nice and strong, and we've got to try and keep this as we move. So you're going to sort of move, shake around just a little bit. And the other focus, if you're looking down, you want to keep this knee straight over the toes. So as you tap here, the knees gonna want to go in, and then it's gonna want to go out. So keep the knee straight over, and this is training that perfect posture through the knee, which is going to be controlled by the ankle. So from here, guys, we're just going to try and do at least 10 squares, and you're going to start to feel the muscles around the ankle starting to fire. So just a really good one. If your balance isn't the best, just make sure you've got a kitchen bench or holding onto a wall next to you. But we're just keeping this as very basic. If you haven't, we didn't do a whole lot of mobility through the ankles or the hips, but be sure to check out my other videos that focus on this, because this may help you as well. Let me know in the comments if this helped and what you want to see more of in the future. Make sure to hit that like and subscribe. It really does help out. And we'll see you again next time. Thanks, guys.